Hi, and welcome to our virtual forum today on the topic of COVID-19 and your benefit plans, new rules for a new normal. Just to tell you a little bit more about myself, my name is Dan Kuperstein. I am the Senior Vice President of Compliance for Corporate Synergies, where I oversee our benefits consulting practice here for clients all across the country, specializing in health and welfare plan compliance and insurance industry compliance for our clients' plans. I am an attorney, and I have been working as an ERISA employee benefits attorney my whole career, and I absolutely love talking about this stuff. So we're going to try to make it fun today, but I realize it's a lot of information. So we'll get through it, and we can. I'm happy to answer all of your questions. So what we're going to talk about today are the new rules, right? The new rules for the new normal, mainly under two main pieces of stimulus legislation, the Families First Coronavirus Relief Act and the CARES Act, which we'll be talking about as FFCRA and CARES. And then, of course, all the guidance and agency rules that came out relevant to that, as well as other deadline extensions and compliance relief for plans and things like that. Then we're going to talk about how to implement a lot of these new rules when you're putting together return to work, COVID-19 testing, and other plan and benefit plan related initiatives that you may be putting into place as part of your workplace policies in light of the fact that many furloughs are now ending and employees are returning back into the workplace. And then finally, we'll talk about some key things to understand when you're working with insurance carriers on pandemic-related plan changes. So we'll talk about some of those COVID-19 rebates and refunds that you may be getting and how to deal with them under applicable laws and regulations. Okay, so let's go ahead and get started. So obviously, a lot has happened, in recent weeks, and we are really kind of in an unusual situation where many of the rules and regulations that were kind of maybe expecting this to be a much more temporary situation ended up being a longer situation than initially thought of. And hence here you see in this picture in Texas, there's a picture of a sign that says closed again. It looks like a bar in Texas that's closing because Texas, like many other states in the South and in the West, saw spikes recently. And here's a chart showing a chart from June 30th of 2020 showing that the United States was not able to reduce their COVID-19 infection rate to the level of the European Union when just a few months ago in March, the United States issued a travel ban against European Union. So we didn't want them coming over here. And of course, now it's going the other way. They don't want us to go over there because of the way that our COVID-19 cases have spiked. And then here you see a chart showing the 7-day average of new coronavirus cases in Florida from the end of June, which also showed a spike. And then here you can see, even at the local level in Houston, Texas, just how, how those confirmed positive COVID-19 cases really spiked at the end of June as well. And then let's also talk about, when we're talking about the new normal, kind of what's happening is, in this environment that we're in. From a workplace standpoint, many employers began to do furloughs, temporary layoffs, partial layoffs, reductions in force, all kinds of things. Including furloughs that included all of the above, right? Furloughs that may have included reductions in hours and temporary layoffs, or even some that may have included permanent layoffs or intermittent layoffs. So really, there was just a broad spectrum of things that happened, really beginning kind of in that early March time period. Now, a lot of those furloughs are now beginning to end as we get into the summer months. And as that happens, right, we are going back into the workplace. And it is a new normal, right? Everyone has to wear masks now. The benefit plans are different. Payment deadlines are still different. There's new things to be aware of. You want to make sure the employees are safe and healthy. They feel safe and healthy when they get back into the workplace. So there's just a lot going on. And the insurance carrier accommodations that we saw at the beginning of those furlough periods were, very broad and expansive. And while some of those are continuing, others are ending. And we'll talk a little more about that later, but that's just sort of one thing that's going on. You may be asking, Dan, why is there a picture of an aircraft carrier and not an insurance carrier? Well, just a more interesting picture to look at than an insurance carrier. And of course, I'm just trying to see if you're still awake at this point. So what's happening, right? Wellness vendors also are pivoting. So one thing that we're seeing is as more employees come back into the workplace, the wellness vendors and other medical plan providers that were doing things like coming into your office to give flu shots or maybe having a wellness fair, they are pivoting, and they're offering return to work programs, employment screening, testing for COVID-19, temperature checks, and things like that. We'll talk more about that later as well. But what are the new rules, right? So we've called this program today the new rules, right? The new rules for the new normal. So what are those new rules? Well, here's a kind of big picture look at the main ones that you need to know if you are in an HR or benefits department. And we will go through each of these things in a little more detail and with a focus on some of the more recent guidance that's come out. But I think the big ones, of course, are the FFCRA and CARES Act that we talked about earlier. Those rules talk about COVID-19 testing and treatment, as well as enhanced benefits that need to be offered under plans and compliance relief. We also saw DOL deadline extensions, special IRS cafeteria plans that give your plans more flexibility, new rules. Some of these were actually under the CARES Act, some in other areas, but that just made it more flexible for telehealth and remote care services, as well as made things easier for wellness and other types of plans. And then, of course, we saw these COVID-19 rebate rules. Really, the rules that are most applicable are under the ACA medical loss ratio rebate rules, which are technically under ERISA plan asset rules. And so those are not as new, but they are new in the sense that we haven't used them in this way before. And so I've added those to the list, and we'll kind of go through each of these now kind of just briefly, and then we can talk more about how it really impacts your plans later. So one of the big things that happened recently was this June 23rd guidance that gave us a lot of clarification about how the FFCRA and CARES Act will apply to your benefits plans. And it was really helpful, and just as sort of an overview, it kind of, since it almost touches on almost every subject about the impact of these two laws on your benefit plans, we can really kind of look at this first, and we can talk about some of the other benefits later, but this really gives us a really good understanding of kind of what happened. And just as sort of general background, right, the FFCRA and CARES Act requires that medical plans offer COVID-19 diagnostic testing with no cost sharing by all plans, both fully insured plans and self-insured plans. And that it will be offered without cost sharing so long as it is prescribed by an attending healthcare provider, and so long as it is a diagnostic test, right? And so those things were a cause of confusion and lack of clarity for a long time, and fortunately they were clarified in this recent guidance that came out on June 23rd. And just as a background, diagnostic testing generally refers to COVID-19 testing that's used for a diagnosis or detection of the disease that causes COVID-19. And also attending healthcare provider was defined to mean any medical provider that prescribes the diagnostic testing. It does not have to be the primary care physician. And so it also clarified in these rules that at-home testing would be allowed. And so it was just, broadened to allow for more types of testing. Before these rules came out, a lot of insurance carriers were charging for COVID-19 testing. for one reason or another. Maybe they said it wasn't a diagnostic test, or it wasn't prescribed by your primary care physician, and they were interpreting this very narrowly. So this really broadens the types of individuals who can get COVID-19 tests. It also clarified that the multiple tests could be used for one individual, required to be covered without cost sharing. It clarified many of the out-of-network balance billing issues, the notice requirements for group health plans and issuers, and it relaxed the rules for telehealth and remote care services, which we'll talk about in just a bit. But let's go back up to just talking about what kinds of plans are covered. One of the big things here, when it clarified which types of diagnostic tests were covered, is that it clarified that it's any type of diagnostic test that's been approved by the FDA or that's on the emergency use authorization list on the FDA website. So it really is a pretty broad spectrum of tests that are now permitted. And so it's just really pretty amazing. Really a lot more can now be covered. And one thing that was really significant here too is it also clarified that return to work testing or employment screening testing is not required. It's not actually a mandate that is included within the FFCRA and CARES Act mandate, which we'll talk about in a little bit. And then, of course, it relaxed rules for telehealth. It clarified that the telehealth and remote care plans can be offered on a standalone basis, that they're not going to be subject to ACA group market reforms, but with exceptions. And, in there, I think one of the things that's interesting is that, generally speaking, some of the market reforms like preventive health, if you have a standalone telehealth plan that you offer, you don't need to provide preventive health care services through that standalone telehealth plan, but you do have to comply with many of the other ACA market reforms like pre-existing condition limitations. It also only applies to plans with 51 or more than 50 employees. So, while there is some relaxing of the rules for telehealth there, not a major change. And in fact, most employers out there do not, most employers and plan sponsors do not offer standalone telehealth because there's so many other issues involved with that. So really still a pretty rare thing altogether. Now, just around the same time, I think it was about a week before, the EEOC issued updated ADA guidance that indicated that COVID-19 antibody testing, when it's used for return to work purposes, violates the Americans with Disabilities Act, or ADA. And their decision to update their guidance, they initially had some guidance that was very broad and allowed for employers to do, pretty broad spectrum of types of employment screening or health screening tests upon return to work. But they said, based on recent CDC guidelines that we received, we now believe that COVID-19 antibody tests are unreliable. But they said that their decision to update the guidance to exclude this type of antibody testing is subject to change as testing develops and becomes more reliable. Some of the key terms here that are really important to understand is kind of this distinction that's drawn out in the June 23rd DOL guidance about diagnostic testing under the FFCRA and CARES Act, right? It's generally referring to testing for the diagnosis or detection of COVID-19, and that includes, the tests that they will allow your health plan, they will require your health plan to cover without cost sharing. Those types of COVID-19 diagnostic tests include both viral and antibody tests. But of course, they're subject to those specific FDA requirements. They have to be medically appropriate. They have to be determined by the individual's attending healthcare provider, which we said before does not need to be the primary care physician. And so that's one definition of testing. Now that agency, the DOL, in that guidance, distinguished that from return to work or other employment screening testing that is not subject to the FFCRA and CARES Act mandate, which would be the type that maybe many are familiar with, which is, testing to see if employees are healthy enough to return back into the workplace. So it basically says that's not in our mandate under the FFCRA and CARES Act. Let the EEOC and those employment agencies figure that out. And since the EEOC and their guidance didn't clarify anything about, well, who has to pay for that, that really leaves open the big question of, who has to pay for such testing? And so it's still an unresolved question as we return into this new normal. Is it the employees or the employer, or who's paying for it? And obviously, if the employees, voluntarily want to go out and get a test from their health plan on their own, that test in most cases, based on all this new guidance and new rules, is going to be free to that employee. That is without any kind of cost sharing. But if it's part of the employment screening process, well, that's just undefined. There's no clear answer to that. Many employees and labor unions and employee groups have argued that employers should have to pay for it as part of the return to work process. And the EEOC has said that it has kind of not really directly addressed that, but it has already led to some labor disputes out there already, as there's been some disagreement on that. Another key term distinction here to be cognizant of, especially as we go through this next set of rules, is the distinction between public health emergency and national emergency. A public health emergency is the time period that these rules are in effect under the FFCRA and CARES Act, and that is a time period that's declared by the Secretary of Health and Human Services, or HHS. It begins, it was announced on January 31 of 2020. It actually runs from January 27 of 2020 through July 24th of 2020, but that's just when it's extended until. In other words, the July 24th date is not an actual end date. It's just the date that it was extended through, and it can be extended for additional 90 days, for 90-day periods by HHS. And so it's very likely that now we're recording this today as of July 15th, and that is an important disclaimer for today's presentation, that everything I'm talking about today is current as of July 15th. But it's very likely that by the time that you're watching this on August 5th, HHS will likely have extended that public health emergency period for another 90 days past that July 24th date. The other key term here that's often used is national emergency. And that's a very different time period. That's a time period declared by the president under the Stafford Act. The president announced a national emergency on March 13th of 2020. It applies beginning on March 1st of 2020 until the president declares that the national emergency is over, which hasn't happened yet. And those national emergency period rules, we'll talk about those in just a minute here, refer to and apply to an outbreak period. The national emergency time period does not refer to it, but they're used, the national emergency is a time period used for purposes of certain outbreak period rules, which refer to the time period of 60 days after the end of the national emergency. And so the ones I mentioned earlier, the COBRA deadline extension rules and other extension rules that apply to extend compliance deadlines are going to be using those, that national emergency time period to define the outbreak period, which is a period of when things are paused. So let's talk about that now. Since I just talked about it a little bit, let's go into more detail into that outbreak period rules and the national emergency. And these rules came out at the end of April and said primarily the DOL was involved in putting these together, and there are regulations that pause compliance deadlines during this outbreak period, which is 60 days after the end of the national emergency. So since it hasn't ended yet, we don't even know when the end of the pause period is going to be. But these rules paused all of these compliance deadlines that you see here on this slide. Probably the most notable ones for most of you out there are the 30 and 60-day HIPAA special enrollment time periods to enroll in health insurance coverage, as well as the 60-day COBRA election period to elect COBRA. Also, the 45 initial and 30 subsequent COBRA, 30-day subsequent COBRA premium payment deadlines under COBRA were extended. And so all of that is really has made it really hard, I think, for a lot of plan sponsors out there to administer COBRA, because I think one of the big issues, of course, that's happening is, well, how do we know, if all the compliance deadlines have been paused indefinitely, right? Since we don't know when the end of the national emergency time period is going to be, does that mean that a person who's on COBRA can just kind of stay on it forever, collecting all their benefits, incurring claims, incurring prescription drug costs, and then does not need to ever have to pay or do anything to indicate that they still want the COBRA coverage, and we have to just keep paying the premiums and the claims costs and all that stuff, especially if you have a self-insured prescription drug plan. I mean, this could be millions of dollars we're paying for this person. Well, the good news is that the DOL has clarified and guided, and we've actually been in contact with the DOL on this topic, is the DOL has clarified that it's a suspension period or a pending claim period, but it's not, it's technically can work in many ways like a termination, although it's not a termination. So in other words, what they are saying is that you treat this like a grace period. So if let's say the COBRA qualified beneficiary, the person who's on COBRA, is incurring claims, but they're not paying their COBRA premium, you can, as the plan sponsor, and you can discuss, of course, with your COBRA administrator if you have one, you're allowed to suspend a lot of the claims and pen those claims. So in other words, they can't, let's say, fill prescriptions or get medical treatments or things like that as if it was terminated, although it's not technically considered to be a termination, because if that participant decides they do want to pay, for all those earlier retroactive periods, then their coverage can retroactively be reinstated, so to speak, even though they haven't been paying. So I think it's unlikely that that's going to be the case, right? Realistically, if they're not paying, they're not going to pay all of the claims altogether. But technically speaking, it is technically considered to be like a grace period, but you do not have to continue to allow that person to incur claims on your COBRA plan. There's some other deadlines that were extended, the time period for filing claims and appeals, for requesting external reviews and additional information. Now, these rules are mandatory for most plans, as opposed to many of the other rules we're talking about, which are discretionary and are allowed to be changed through plan amendments at the discretion of the plan sponsor or employer. So these are things you absolutely have to do. Now, in most cases, your plan administrator or COBRA administrator will pretty much handle these notices, but you really want to make sure as the plan sponsor that you are doing this, that you are communicating these changes in the rules to your participants. And while we refer to these rules as the outbreak period rules, kind of makes everything easier to explain. While they do not require that any communication or disclosures be sent out to participants, and there's no plan amendment that's required, for example, you do want to make sure that you do let participants know about this, because if your plan is subject to ERISA, then of course ERISA fiduciary duty rules could apply that would dictate that the notice of material changes to the plan be dictated, be furnished to the participants. And there is also some relief here for plan sponsors acting in good faith to give them time, to allow them to send out notices as soon as practicable, given these unusual circumstances, the new normal that we're in, with how difficult these compliance deadlines can be. And here's kind of a list of all the different notices and disclosures that may be affected as a result of these new rules. And so I think if you're looking at key takeaways here, while obviously, I guess you could say a belt and suspenders approach would be to make sure that every single plan communication and notice has been amended properly and takes into account these special extension rules that go into effect on March 1st. That's not, since that's not actually required in the rules themselves, that's probably not what you absolutely have to do from a regulatory compliance standpoint. But I think at the minimum, you could probably do the minimum defensible plan of action to take, or and the least that you could do is just to put some kind of summary of these changes on your benefits website and notify them. Probably the easiest thing to do would be to do it on like an intranet or an email, or if you don't have, if employees don't have access to that, on a postcard. You also want to make sure you're reaching out to participants and COBRA qualified beneficiaries, especially those who don't have access to websites, about these election period and premium payment period extensions, especially if they expire during the outbreak period. There is a rise in COBRA litigation that's out there, and so it is something that's important to do. At a minimum, you could probably even send out a copy of our e-alert on this topic, just so that everyone is aware of kind of what happened. And then, you also want to make sure you're reaching out to your vendors and your carriers to ask if there's going to be any additional fees to, for example, to update notices, or if there's any kind of way that they can customize their approach to fit within your particular plan of benefits. Those are important things to understand because every plan is different. And we've seen that in many cases, the vendors and COBRA administrators have been very flexible here and have allowed the plan sponsors to include specific language that they thought would be better. And of course, one big takeaway is, based on everything I just said, don't use the word terminate for failure to pay, because that would not be in compliance with the rules, but you can say suspended. If you don't pay your COBRA premium, your coverage will be suspended, or claims will be pended, or something like that, but don't say that your COBRA will be terminated. That's an important takeaway there. Okay, so let's talk a little bit about one of the other big changes that happened. And, I think one of the things that caused a lot of confusion also about, these new normal rules was the IRS issued a lot of guidance giving cafeteria plans flexibility during the pandemic to, if they wanted to, right? That's why I say flexibility. They had the discretion to amend their plans to allow for certain cafeteria plan election changes, changes to health FSA elections, as well as grace periods and carryovers. And what's in this, right? So what was in this IRS guidance? Well, the first part was this IRS Notice 2020-29, which allows employers and plan sponsors interested in taking advantage of this relief. They can prospectively enroll employees or family members in employer-sponsored health coverage without a qualifying event, right? I think if you're familiar, there's a special mid-year election rules that require that there be some kind of qualified event. Of course, like the, birth of a child or divorce or something to, allow for elections. Now, of course, you don't have to have that event. You can just, allow them to enroll. You can allow employees to change to another health plan option of the same employer and without an event. And you can revoke health coverage. I should say without an event. You can prospectively revoke health coverage, but only if the attestation is provided that the employee is or will be enrolled in other health coverage not sponsored by the employer. And all of this can be done with an amendment. Now, the amendment to the plan is required by December 31st of 2021 if you want to take advantage of these changes, but there's a lot of flexibility there. Then also with health FSA elections, you can prospectively enroll, increase, or decrease or revoke the both I should say health FSA and DCAP FSA elections for any reason. So just again, no reason is needed. And then, of course, by plan design, employers can also get much more specific in how they limit or decrease the FSA reimbursement level. So you can even limit it to the amount that's already been provided, which is very flexible. You can say that salary reductions must be prospective, and any increase may be used for amounts incurred in the plan year prior to the election change. So you do want to make sure that, of course, that things are not, in other words, you don't want to be retroactively, paying things out that have not already been incurred. So it's very specific to, it's very clear that the changes have to be prospective and cannot be retroactive. So in other words, that there's no refunds being paid out, for example, to participants. And then just like the other cafeteria plan election changes, these rules can be implemented for the plan by an amendment required by December 31st of 2021. And of course, there's also new guidance on grace periods. There's an extension of the grace period is allowed for plan year or grace periods ending in 2020. Grace periods ending in 2020 can be extended through December 31st of 2020. And a plan year ending in 2020 without a grace period can extend the plan year through December 31 of 2020 to allow for these extended grace periods. And then also there are special carryover rules that the carryover amount can be increased to $550 for plan years beginning on or after January 1, 2020. the plan amendment required for that is, and for all of these above, is by December 31st of 2021. Okay, now this is just a pretty big, quick overview of everything that's happened, of course, but I think it's important to mention that there's been a lot of other new rules, especially with regard to telemedicine, with regard to wellness, high-deductible health plans, HSAs, and so, I mean, we obviously could just talk all day for hours about all of these things. Some of the big ones to be aware of is that the CARES Act did make some changes applicable to high-deductible health plan and HSAs, health FSAs, and HRAs. Basically, the legislation removed the requirement for the prescription requirement for over-the-counter drug reimbursements that previously applied to health FSAs, HRAs, and health savings accounts. Additionally, menstrual care products will now qualify as medical care for purposes of reimbursement or for tax-free distribution. And those changes apply to expenses incurred after December 31st of 2019. And so the key takeaway there, of course, is that that's up to the plan sponsor. So the plan sponsor does not have to do that, but that's a way that the plans can be made more flexible. There was a telehealth exemption for high-deductible health plans that allowed high-deductible health plans to cover telehealth and other remote care services without a deductible for plan years beginning on or before December 31st of 2021. And that went into effect on March 27th of 2020. So a lot of new rules here. There were wellness rules that relaxed wellness requirements, and specifically there was a rule about certain plans do not have to you don't have to meet all the different standards of the wellness plan if they require in-person requirements. So there's just been a lot of relaxation of these rules. Additionally, there was reduced enforcement. Department of Health and Human Services reduced the enforcement of HIPAA against the telemedicine providers, but they did not do that for plan sponsors sponsoring telemedicine plans, but just something to be aware of. So there's been a lot of sort of relaxation of a lot of rules for a lot of benefit plans. We obviously don't have time to talk about everything today, but I think the big ones we've really covered here. And then, of course, the MLR rebate rules. So we've talked a lot about these in past forums and past webinars for our clients. So and we're going to go into a little bit more detail about those rules again later. But basically, they require that you apply. If an insurance carrier is going to be paying out a rebate or refund on a fully insured policy that they may recall a COVID-19 rebate or refund, in most cases that's going to be an advanced MLR rebate, and so that money, if to the extent that is composed of participants' contributions, which are referred to under ERISA as plan assets, that money has to be paid back to participants, and there's within 90 days of receiving that money. And so that's something that we'll talk a little bit more in detail about later. But first, let's talk about some of the main initiatives, right? COVID-19 diagnostic testing, return to work initiatives, other initiatives that may implicate, benefit plan rules and requirements. And I think as we go through this, you'll see there's a lot of hoops that you have to jump through. Not all of them are so easy to figure out. And so why don't we start with an easier one, and then we can kind of go through some of the, some of the harder ones. But we'll basically look through some of the major types of things that we're kind of seeing as employees return to work, and kind of what are some of the compliance implications of these changes. If you want to do one of these types of things with your plans. So why don't I get started? Let's talk about FDA approved COVID-19 antibody testing for return to work purposes. Well, that was pretty easy, right? Because we already talked about the fact that the EOC issued guidance saying you can't do that. So that's pretty straightforward. You don't want to be including that. What about FDA approved COVID-19 antibody testing offered on a voluntary basis That's perfectly fine. So in other words, if let's say you want to say to your employees, it's voluntary. If you want to get COVID-19 antibody testing, you can. It's, offered without cost sharing. Yeah, that's what we talked about as well. That's perfectly okay as long as you're not saying, you need to do this before you can return to work to, screen out who's healthy and who's not, because the EOC has said that's unreliable, and that would be in violation of the ADA. Okay, what about non-FDA approved COVID-19 antibody testing offered on a voluntary basis? Well, that should be okay, right, as it's not necessarily going to violate any law on its own, right? But if you're offering that through your health plan as a covered item, well, it's probably not going to be one of those it's not going to be a CARES Act FFCRA approved antibody testing, so it won't, it's not going to be covered without cost sharing. And then, of course, you're going to have participants and employees coming to HR or benefits department saying, hey, why did I get this huge bill for an antibody test, right? So probably not the best idea to do that, but there's nothing necessarily that's legally wrong with it. Obviously, you couldn't use that, like we just said, for return to work testing since it's antibody testing. And really, that was a big issue we saw, right? Before the guidance came out on June 23rd, a big issue that was happening was that we saw some very big bills, very big charges by carriers for the antibody testing because it wasn't FDA approved. And so it's probably just isn't worth the headache, right, to offer that. What about COVID-19 viral testing for return to work purposes? Well, that's okay. The EOC in their guidance says that's okay under the ADA. Really, there's probably nothing wrong with that. You don't necessarily want to always do that. If it's there's something we should talk about is that you may not always want to run these things through the health plan. In fact, you probably don't want to. The reason for that is because that the HIPAA rules have not been relaxed. It was one of the, while HIPAA rules have been relaxed for telemedicine providers as part of all these new COVID-19 rules, they haven't been relaxed for plan sponsors. And so, you as a plan sponsor or employer, you don't want to be looking through your medical plan's data to see if an employee has obtained a COVID-19 test or not, or got a specific result or not, as that's not only likely to, be a violation of HIPAA, but could also likely be a violation of other privacy laws. So definitely not something you want to be doing through the plan. It's probably best to have it done through a third-party vendor who can offer the COVID-19 viral testing on a return-to-work basis. And so, that's kind of, I think, something that you'll see is kind of a theme with a lot of these other ones, right? You don't want to be doing any of the stuff through the plan. You want to probably be doing this through a third-party vendor and making sure that the data that's collected by that vendor is not going through the plan in any way, so it doesn't constitute protected health information and violate HIPAA. What about COVID-19 viral testing offered on a voluntary basis? Well, that's also okay. But if you're doing it on a voluntary basis, you may not. That's where you probably do not need a vendor, right? Because that's going to be offered to your plan. So that's going to be offered without cost sharing through the plan. What about COVID-19 take-home tests? Also should be okay. It was okay in both types of guidance, but it may not be as reliable, right? If it's going home, you may not want to use that as a return. It may not be as sort of a safe bet, right, for returning employees back into the workplace, because if it's a take-home test, you don't know what they're doing with it or whose health information is really coming back to you. Temperature checks, okay. What about on-site and mandatory tests? Those are okay. Temperature checks, certainly there's no compliance benefit plan implications of those. The data from that also should not go through a health plan. Also, you may not want to have someone from the HR department or an employee who's not trained in how to do it correctly to be applying that. And also, just like the take-home test, there could be some reliability issues there because, as we know now from just science, there are people who are asymptomatic who don't have any fevers or high temperatures, and so it's not the most reliable method out there for return to work screening. What about acknowledgement forms, right? Self-acknowledgement forms provided to returning employees asking about their contact with or exposure to COVID-19. Those are good. Those are perfectly fine and reasonable, and that's what a lot of employers have done. What if those self-acknowledgement forms provided to returning employees request specific family medical history that's not specific to COVID-19 risk? Well, that's not okay, right? Then you're getting into issues with potential ADA and other labor and employment violations. Definitely not something that you want to get involved in. So a lot really depends on what's in that acknowledgement form. It's best to keep it specific to contact and exposure to COVID-19 in those forms. Okay, well, what about plan amendments, SMMs, and updated SBCs? Is this something that's absolutely required? What are the compliance rules for this? Well, interestingly, it's not an actual requirement in any of the rules. There are, just before we kind of go into a lot of the detail here, there are in the new guidance for June 23rd from the DOL, they said that there is a requirement relevant to SBCs where you can, if you haven't already provided a notice, you can provide a notice. But in most cases, the carrier is going to be making those SBC changes, even for self-insured plans, even though the self-insured plan could technically be liable for that. In 99.99% of the cases out there, the carrier is going to update the SBCs. There's no real requirement on the employer anywhere to do that. But like we said before, right, there is an ERISA fiduciary duty to provide your participants with all of the information that's material to know about the plan and changes to the plan. So we always would recommend it. So while not absolutely required, we recommend it, that you do go out and make sure that all notices have an update. You may not need to amend your plan or if you're not, for example, doing something like adding those cafeteria plan flexibility rules or making major changes, you probably don't need to do a plan amendment or an SMM for your SPD, but you do want to make sure that your notices, especially about COBRA, are updated with those special deadline extension and relief rules. And that answers my last question here. What about COBRA notice updates and COBRA administration consulting services? You definitely want to make sure that those COBRA notices and the COBRA administrators and vendors that you're working with to handle those services are making sure that there's appropriate language about the COVID-19 related deadline extensions, those outbreak period rules we just talked about, because there has been a big rise in COBRA litigation. One other confusing thing here is that the DOL after the COBRA deadline extension rules came out, the DOL issued model note COBRA notices that did not include any discussion of that. And so that added a lot of confusion out there. But in the end of the day, it just still makes sense to include, even though those COBRA model notices said nothing about the COVID-19 deadline extensions, it still really makes sense to include that information in your COBRA notices, given how material that is to participants and beneficiaries. Okay, what about the insurance carriers? We've talked a lot about plan sponsors, employers, and benefit plan, benefits that have to be offered. What do you have to do with your insurance carriers? Well, a lot has changed, right? In the very beginning of the pandemic, where furloughs were commencing and everything was put on hold, the insurance carriers were doing a lot. They were covering testing for COVID-19 at 100%. They were promoting telemedicine and virtual visits. They're waiving member cost shares, waiving charges for home delivery. So these were all the kind of things that they were doing. They were waiving population change provisions for re-rating groups, considering employees to still be actively at work for purposes of to maintain their coverage while they were on furlough. They would allow, they would amend the plan that way. They did all kinds of special midterm open enrollment things. So just a lot of changes were granted. A lot of accommodations were granted, and then what happened was, of course, now those accommodations are coming to an end. Most notably, the active employee status retention language that keeps those employees active while they're on a furlough period. That's going to come to an end, as most of those really only lasted for about 90 to 120 days. So, pretty much by the end of August, most of those should end. And as a result, now, of course, employers are faced with decisions about which employees should we retain, what hourly status, should we COBRA them out, should we offer them coverage? And of course, there's many resulting compliance implications for that. One of the big things, of course, is, how do you, what does your plan say, right? And that's one of the big things, right? If you have a plan document that syncs your plan eligibility terms to the terms of the ACA, and you're using measurement periods and stability periods that are 12 months, right? If those individuals are qualified to be considered to be a full-time employee during the measurement period that happened before, and now they're going to be in a stability period, and they've been actively at work all of this time. You will have to then, of course, offer them coverage for the duration of the associated stability period, that period that's associated with that measurement period, and that means you have to offer coverage for that 12-month time period. Well, you may not want to have to do that anymore. You might, want to cover these people out, or in the future have the right to do that. And so you may want to change your plan document to give your organization more flexibility, maybe put them on a monthly measurement method, or reduce the length of those look-back measurement periods to give yourself more flexibility in the future. Certainly something that many employers are considering right now, and we can help you out with at Corporate Synergies. But something that I think is definitely worth taking a look into, and a question that's come up quite a bit. Also right now, carriers are providing COVID-19 rebates and refunds. This really kind of began in late June, mid to late June. They began offering these rebates and refunds, as well as premium credits to employers that were sponsoring fully insured plans. And in most cases, these were actually advanced MLR rebate checks, because insurers, there's certain ACA MLR rules that basically say that the insurers cannot get too profitable. So if their medical loss ratios are a certain percentage, anywhere where they're more profitable than that, they have to return that back to the plans. And of course, that leads to the question, of course, of, well, what do we do with these refunds, right? Let's talk about the COVID-19 refunds. If I'm an employer, can I just pocket that money and take it with me, and can I keep all the money? And the answer is a clear no under ERISA, because employers that are receiving such rebates, refunds, really need to be careful that they're following the ERISA plan asset rules. And since these payments are actually advanced MLR rebates in many cases, or at least they're very similar to those, then you can actually follow the MLR rebate rules, which explain how to apply the ERISA fiduciary rules or ERISA plan asset rules to those rebate monies. And the way this works is that, and let's just kind of break all this down in plain English, right? The plan assets are essentially the money that's paid by the participants in the form of premiums or plan contributions, or that's monies that are being held in trust for the benefit of the participants. That money is really the participants' money, right? So that's the plan assets money. And that amount of money, right, needs to be returned to the participants or paid out to them in the form of benefits or a future reduction in their benefits cost. And so in other words, you have to, as the employer and plan sponsor, you have to do the math, calculate what percentage of the rebate or the refund is plan assets versus not plan assets, and then pay out or refund to your participants the amount of that percentage that was their contributions that they paid into their plan asset amount. And that timing of that payout has to be within 90 days. So if, let's say, you're going to do a premium holiday for a month or 2 months, that still has to take care of that amount of money within that 90-day time period. And there are exceptions there as well. So this is just sort of a brief overview of how these rules work. There are exceptions for de minimis or small amounts of refund monies, which is not defined in the regs, but in other situations where it's too difficult, for example, to find past participants, they let you give it to the current participants. So there's a little bit of flexibility there as well. And then what about plan changes, right? About like handling the notices and the plan administration changes, right? What's been happening there with carriers? Well, in most cases, fortunately, the carriers and the COBRA administrators have been handling these notices and administrative changes. And so they've been the primary party there responsible, even though at the end of the day, right, as the employer and plan sponsor, in most cases, unless you're a church plan or you're exempt from ERISA, in most cases, you have ERISA fiduciary duties, and you need to make sure that they're still giving out appropriate notices and explaining to participants the material terms that have been changed of those benefit plans, because that can, failure to do that, of course, can lead to penalties, as well as can subject your organization to potentially to ERISA and COBRA litigation, which, especially in the case of COBRA, that's been on the rise. Okay, so what's next, right? We're getting close to the end here. What's next? What are we watching, and what are we watching very closely? Well, one big thing that I think has come up quite a lot with a lot of our clients is, well, is there going to be any kind of transition relief for the ACA affordability rules? And I think every year, as you know, every year we get guidance from the IRS in the form of instructions for how to complete the forms 1094C and the 1095C, and in that there's usually some kind of transition relief or some kind of relief that allows people to, for special situations. Well, affordability is going to be a big one, right? Because you have all these people who just haven't been working at all, and they haven't been earning any money. And so if you're, let's say you're one of the many employers around the country who was using the ACA's W-2 safe harbor, basing the affordability of your health insurance premiums on the cost of that, the cost of that health insurance premium to the employee versus their W-2 income, well, that's going to be a big problem because there's lots of people out there who are not, even though they're considered to be actively at work and you have to report on their behalf on the Form 1094C and 1095C, they really weren't earning anything. So that's going to be very problematic, and hopefully we'll get that guidance soon from the IRS. We're also looking for new reporting rules and guidance under the FFCRA and CARES Act, so that how to report on such things as everything from the leave rules and other compliance requirements. That under those laws, we're watching out for other types of penalty and deadline relief that could come out, for example, PCOR fee or ACA insurers fees. So we're watching that closely, as well as new guidance on COVID-19 antibody testing. Maybe the EOC will decide that it is more reliable now. Some of the more recent things that we've been seeing is that the antibodies don't seem to last as long as people had thought. In some cases, there's cases out there that may be less than 30 or 60 days even. And so that's problematic. So we'll see as more information comes out about antibody testing, as well as about vaccines and other treatments. So we'll keep watching those things carefully, and also for watching out for things like carrier relief and accommodations, including more information about rebates, refunds, and credits. A lot of that is going to be on our COVID-19 resource page, which we'll give you a link to in just a minute. And of course, we're watching out, as always, for state and local developments. I mean, we are a national benefits consulting firm with clients all across the country, but we still watch very closely what's happening at the state and local level, particularly in some of the hotspots out there, Florida and California and New York, where we've seen there's a lot of very interesting new rules and leave requirements and compliance rules. And so it's something that we're watching very closely. So what are some of the key takeaways here, just as kind of before we close for the day? What are some of the big things that you as an employer and a plan sponsor should be thinking about, as you go into this new normal and as employees return back into the workplace in many cases? And so I think, one of the big, real big takeaways here is that, of course, this is a very fast changing regulatory landscape. When you consider all the new benefits rules, as well as, all of the other federal, state, and local health and safety requirements and recommendations, there's a lot out there, right? So we would just always recommend that you work with your trusted advisors, including all of us at Corporate Synergies, to develop the appropriate plan, communications and notices, and as well as screening logs and forms and a detailed return to work playbook and outbreak response plan. And we can really kind of help you in many ways with that, particularly as they apply to your benefit plans. You want to review all the new and or proposed benefit plan changes and third-party vendor services carefully. You want to look at those service agreements and see, well, are there any prohibited services such as antibody testing for return to work purposes, right? That would violate the ADA. So that's an obvious example, but other things too, that we talked about today. You also want to read the fine print in all the new service offering agreements and ensure that your organization is not, taking on too much of the risk, and ensure that the whatever proposed return to work programs or benefit plan changes that you're putting into place, that they align not just with your workplace policies and your plan documents and your return to work playbook, but also with your larger company culture and your company's values and its benefits philosophy. So that's pretty much the big picture. We really want to thank you for joining us today. Here are some links. We have some links in the materials here for our Coronavirus Resource Center, as well as our Employee Benefits Compliance Resources Center, and some other great links to join us on social media. And again, just as a final disclaimer, right, everything today is current as of July 15th. But we definitely, we're all here to answer your questions, and we look forward to hopefully talking about this with you soon. Thank you.